Hey, 45 minutes past the hour. It's a beautiful Wednesday. We're halfway through the week, and we're talking with People's Health Clinic. Some of my favorite people to interview, which, you know, I don't know if I expected that at the beginning, but they have so many incredible volunteers and those that help at the People's Health Clinic to make this clinic what it is. It's amazing what it was 10 years ago and what it is and has become today. And we were talking with one of those, and that is Dr. LaMere. And I said your name wrong earlier in this show. I don't know what I called you, but thanks for being here and thanks for being so fun to be with. So you're just one of the, I mean, you're essentially giving your time to the clinic, and what a great thing to do. So you've been there for about 4 years, right?
Yes, I've been here almost 4 years, and I've been at the clinic for a little over 3. And you know, I volunteered occasionally 5 years ago when we would visit. And then when we moved here, actually I went full-time at the clinic, at least on Thursday nights. So I have a pediatric clinic on Thursday nights, and we have other pediatricians who actually volunteer through the week. And, you know, from 700 visits the first year to 7,000.
Isn't that cool?
The bus that we had, the little place at Windy Ridge, the yard, and now our wonderful clinic up by Intermountain Health Hospital, which they, you know, they built basically. So Dr. John Hanrahan has been absolutely
He's a wonderful man.
The heart and soul.
Yeah.
He's back working, and a few years ago he and my wife worked together to get a bill passed so that we can have doctors who have licenses in other states who are visiting here. If they're here for the winter or summer, they can actually volunteer at the clinic.
That's so cool.
And
because there's so many people that come, probably like you did for years. You come here for the season, and you're enjoying, but you may want to volunteer a little bit of your time. So it's a pretty neat
you know,
thing to do.
we live in such a wonderful community with the number of volunteers that we have, and you know, part of it is giving back. I've had a wonderful career, and I actually work part-time at the university, and I work in pediatric urgent care there. And the university has been so supportive of the People's Health Clinic. The family practice program and the PA program brings students up and residents up 1 day a week to work there. Dr. John Houchins has been instrumental in that. And so we have a lot of support. And, you know, we are a model for, you know, helping people without medical insurance in this country. So it's really, really a wonderful program.
Well, and People's Health Clinic is helping those that are uninsured. And I mean, a lot of us know or may have experienced that times got tough the last couple years, and a lot of people have lost their insurance. So the clinic has been essential, and they've seen this huge rise when the economy goes down. So not only is it essential for those that are volunteering their time and helping to keep it running, but the monetary donations and what the people in the community have done to keep it really running. And the gorgeous building is just incredible to see.
We have a few programs coming up. We have a pig roast that's going to be, I think, at the Waldorf. They volunteered, and there's going to be a fashion show at Grappa. Bill White Industries has donated Grappa and all the food, and so there's going to be a ladies' hat day. So you know what, the community really comes out to support this because, you know, we're a resort area. And we have so many people who actually make a fairly good living here, but because it's seasonal, they get no benefits.
Exactly.
And it's really important to take care of those people for, you know, for Park City.
Absolutely. Some of the best parties benefit People's Health Clinic. Hands down, some of the best things I've been to are fundraisers for People's Health Clinic. So always keep your ears and eyes open for those. Let's talk about, you know, we're going into summer season, and I'm already seeing bikers out, and the safety of what we really want to remind parents with their kids, but maybe not just the kids, but the parents as well.
The parents, you know, and especially adolescents. I kind of specialize in adolescents, and you know, one of the things that we see in the summer as well as the winter, we see a tremendous number of injuries and accidents, especially where I work in urgent care. One of the things is bike safety, skateboard safety, our jump park. And you'll notice that the people who are there all the time are always wearing helmets. Early in the morning, all the bikers, they always have helmets.
They understand the risks.
Correct. I'm not proud of my helmet, but it's got a dent here, it's got scrape here, and my poor head would have taken a hit with that. One of the important things is that, and you can go to any bike store, they'll be happy to help you fit. I always see people you know, are riding and they got their helmet on like this. You know, it looks cool, I guess, but your helmet has to fit correctly, and they'll be more than happy to help you do that, as well as gloves. And certainly if you're a mountain biker, people, you know, wear all their gear. So that's really important for kids. And one of the things is I'd like the whole family to wear helmets. You know, because we're a dad and we're a male does not mean our head may be harder, but it still gets injured. But
let's be honest, you're also setting the example for your kids.
Correct.
A lot of the boys going, and girls I should say too, going through that stage of, well, if dad doesn't wear it, I want to look cool and not wear it. But, you know, teach them that it's the cool thing to wear it.
You know, you're right. Because, you know, 10 years ago, you saw people wearing mostly black riding. Now you have every color in the world.
Oh, yeah.
I mean, and, you know,
how many years ago it wasn't as big of a deal?
You can see them. You notice them when they're on the thing with the bright yellows and bright oranges and bright purples. So the other thing I'd like to talk about, we have had a wet season. And so we are going to have a big mosquito season. As McLeod and Poison Creek overflow a little bit, there's going to be standing water. We have West Nile. We have you know, mosquitoes. We're going to have a big mosquito season, I think. And you know, I just brought some products. Everybody's pretty familiar with DEET. A company called Sawyer makes a time release one, which is it makes a time release. It'll last all day. And then there are actually some natural products. There's one called Picardin, and so there are pest-off natural products for people who don't want to put all the chemicals on their body. The best thing to do is actually wear long sleeves, button up, have a, you know.
That's hard to do when it's hot.
It is hard to do.
It's so hard to do.
But the mosquitoes come out early in the morning and in the evening. You know,
times when you know,
so it's
we're
going
out.
to be important, I think, and you're going to hear more and more about this, as well as sun safety.
That's good to know. I had not even thought about that. So yeah, sun safety is always a big one. With our elevation too, you burn so quick. People come here and they're like, "Oh my gosh, it's the middle of winter and I burn." I'm like, our elevation, you're a prime target.
Most face products now and moisturizers all have an SPF 15.
Yeah, they do.
And we need to do at least a 15. They have facials. This is a 30. This is a dry product that does not get in your eyes. There's some sports products. I've
used that one. It's great.
Yeah, and this is a 70. You know, that is probably way overboard.
Tell me, is there a big difference? Once you hit over like 55, is there a big difference?
No. Oh, okay. Oh, yeah, of age? Absolutely.
No, like, no. Of like 50, 55, and then the 70, and then the 80. Is there a big difference? There's not, right?
15 is 97% protection.
Okay.
50 is 98.5%. I mean,
so
you know, they make a big thing about it, but the biggest thing is applying it. You need to apply it every 2 to 3 hours. If you're swimming, every couple of hours. You know, everybody should have this in their backpack. And, you know, they have some great sticks you can just rub on because it only takes a little bit, you know, and especially where we are here. You know, 7,000 to 8,000 feet, you're out hiking all day.
That's amazing.
And you know what, you do get burned.
Yeah, so really good things to keep in mind. Thank you so much for all the points.
You're very welcome. I'm glad I could be here.
You've got so much to talk about, too. He's so well-rounded between the things he you know, he doesn't know what the meaning of retired is, so he's just a go-getter, and you'll probably see him a lot around the community of Park City. So thank you for your time and everything you do.
Thank you, Jen. I appreciate being here.
Absolutely. We're going to take a short break. We'll be right back to wrap up hour number 1 after this.